Our next topic may be embarrassing, but it is a reality for many people. We're talking about the debilitating nature of incontinence. Joining me now is Dr. John Aversa, a colorectal surgeon at Griffin Hospital's new Center for Bladder and Bowel Control. Welcome, Dr. Aversa.
Thank you, Jocelyn. Nice to see you again, and thank you for having me here today. I'm looking forward to talking about a subject that's very, believe it or not, exciting to me and very important to my patients.
But for some people, it is a tough issue to talk about. What exactly is incontinence?
Well, we're going to talk specifically today about bowel incontinence, also referred to as fecal incontinence. There are different types. So this is when a person loses the ability to control their bowel or bladder function, in other words, has accidents. And this is a condition that affects, at least the bowel incontinence affects over 18 million Americans, and 2% of our adult population at any given time has symptoms of bowel incontinence.
And it really affects their quality of life, doesn't it?
Yes, I have many patients who are otherwise very healthy, vigorous people and no longer feel that they can do normal things like go to work or participate in sporting events. They stop going to family events, and they actually become housebound because of this condition.
Well, let's talk about some of the services you offer at the new Center for Bladder and Bowel Control. What should patients look forward to seeing there?
Well, what we realized about a year ago is that at Griffin we had several doctors who had a strong interest in pelvic floor problems, including urinary and bowel incontinence, also constipation and pelvic floor prolapse. And several of the doctors were already providing very cutting-edge therapies. And actually occurred to me that why not organize this and try to come up with a multidisciplinary approach that's a very comprehensive approach to taking care of these problems. At our center, we have a registered nurse navigator. If you call the center, you'll be in touch with her first. She can often answer simple questions for you, and then if you're interested in seeking treatment, she will direct you to the doctor who's most appropriate for you. At this point, you'll set up an appointment to see your doctor, who will start to orchestrate whatever type of diagnostic tests that you will need. And as we are developing the center, we're hoping to bring all our diagnostics to Griffin Hospital, and then eventually this doctor will guide your therapies, which could include medical therapies, specialized physical therapy, including a therapy called biofeedback, and lastly surgical options.
So the patient gets this real personal treatment. And the Center for Bladder and Bowel Control is at Griffin Hospital. Take a look at the information right there on your screen. It is located in Derby. The phone number for you to call is 203-732-7202, or visit griffinhealth.org. Now, Dr. Aversa, you also have perfected a procedure there. Can you tell us more about that?
Well, this procedure we're talking about is InterStim, also referred to as the sacral nerve stimulator. This is actually a new application of a therapy that's been available in the United States since 1997. In 1997, we started using it for patients with problems with bladder control. In April of 2011, the FDA approved it for patients with bowel control. This was a therapy I had known about because there was European data that showed very good results, and I was very anxious to be one of the first to provide this to my patients. So with the assistance of Medtronic, we were able actually to be the first center in New England to provide this therapy off the FDA trial.
So it's basically less invasive?
It's a minimally invasive type procedure. This is an electronic device. It's similar technology to pacemakers that are made for cardiac conditions. There's a wire that's implanted near...
we're showing it right now.
Yeah, near the base of the spine, where the nerves that innervate the pelvic floor come out of the spine. This device then stimulates the nerves and actually modulates people's ability to control their bladder and bowel function.
It's amazing. Now, really quickly, I understand so far it's been very successful.
Yes. Since starting to perform this procedure, I'm getting a lot of, this is a patient population I've seen a lot of, but I'm even seeing more. What I'm realizing, a lot of these people are undertreated. And I have a very specific protocol I put them through in terms of making sure they're the right candidate for the therapy. And oftentimes we'll be able to institute even less invasive or medical therapies with some success, but the patients who have received the device so far have had success that's almost too unbelievable for me to believe. I had patients who had disabling incontinence that are now almost completely returned to normal continence.
Very good. Thank you, Dr. Aversa, for joining us. Thank you all for watching. Make it a great day, everybody.
I don't know.